My name is Dr. Mohammed Atiyah. I'm a consultant orthopedics in Emirates Hospital, Jumeirah. Today we'll talk about one of the most common causes of hip pain above the age of 50, which is hip osteoarthritis. Osteoarthritis is the normal wear and tear that happens in any joint by time, leading to a progressive loss of the articular cartilage of the knee. Patients with early osteoarthritis will complain from pain in the hip with prolonged standing, prolonged walking, from sitting to standing position, that will progress in the moderate cases to a functional limiting hip pain, hip stiffness. The patient will complain of his inability of even tying his shoe. In the severe cases, that will lead to a mechanical instability, locking, catching, gait alteration, and even can progress to a leg length discrepancy. Other than clinical examination, hip osteoarthritis is diagnosed by a simple X-ray of the hip that is done in a standing position, and it will give us also an idea about the grade of the hip osteoarthritis. Treatment of hip osteoarthritis depends on the stage or on the grade, and we have 3 grades of hip osteoarthritis. Grade 1 and 2 will benefit from conservative treatment, which is in the form of weight reduction, physiotherapy or exercises for strengthening of the muscles around the hip, and medications to control the patient pain. Grade 3 osteoarthritis or severe osteoarthritis, end stage osteoarthritis, due to joint space narrowing and limited range of motion, there will be friction between the femoral head and the hip socket. This friction will lead to the development of ulcers, and these ulcers will lead to femoral head deformation, as we see here in the patient X-ray. At this stage, the patient unfortunately will not benefit from conservative treatment, and the solution will be surgical by performing total hip replacement. Now I will show a simple descriptive video on how we perform the total hip replacement. A skin incision is made to access the hip joint. Once the hip is reached, the diseased head is dislocated from the socket and removed from the end of the femur. Now the hip socket is exposed by using a specific instruments, a perfect hemispherical bone socket that matches the external shape of the new cup is formed. The cup is carefully positioned in the new socket after confirming the appropriate size of the cup. This cup, having a specific metal surface that allows the ingrowth of bone over the metal and stabilizes the cup in place. The inside of the femur or the thigh bone is cleared and widened by a specific device, and the prosthesis is placed into the femur. A trial head is placed on the top of the femoral stem. The hip joint is then reduced and evaluated for the stability, range of motion, size, and leg length discrepancy. Once the appropriate combination is found, the permanent implant will be inserted into the thigh bone, either by a press-fit cementless technique or by using cement, depending on the patient's bone quality. After performing final evaluation, the hip will be reduced back in place and evaluated again before closure of the wound in layers. Total hip replacement surgery can be performed with multiple approaches: anterior, lateral, posterior. In Emirates Hospital Joint Replacement Center, we prefer using the posterior approach, although it's a technically demanding approach, but in this approach we don't violate or detach any of the important muscles around the hip, especially the abductors. And this is allow the patient for early mobilization 24 hours after the surgery. The patient will start walking the next day after the operation with normal walking. There is no gait alteration. It will facilitate the rapid functional recovery and with a tremendous reduction of the post-operative pain due to the absence of muscle violation. Now we'll show you some examples of patients that performed successful total hip replacements in Emirates Hospital Jumeirah with posterior approach. Here is one of our patients. He's a 51 years old with an old hip dislocation, preoperative X-ray, severe joint space narrowing, osteophytes, deformation of the femoral head. And here is the post-operative picture after we have restored the hip alignment. The joint is stable, very good inclination and very good position of the hip, and the patient returned back to his daily activities happily. Another case of a 60 years old male patient complaining of hip pain for years. severe limited range of motion, as we see here his preoperative X-ray, severe end-stage osteoarthritis with osteophytes, ulcer, femoral head deformation. We performed his surgery with posterior approach to the hip, and this is his post-operative X-ray. We restored the hip alignment, perfect position of the joint, perfect inclination and anteversion. This patient dream was to pray on the ground, and successfully we have achieved the patient dream that he can be able to pray on the ground happily. This case is a very interesting case that I will stop for a while regarding this case. This is a 65 years old female patient that was complaining from left hip pain for years. She did a right hip replacement in another facility 2.5 years before I saw her. She had a very good operation, good position of the hip. It's stable, everything's fine, but this surgery was done through a lateral approach. This patient, the only concern that she didn't want to go through the severe post-operative pain that she experienced while she was doing the right hip. The idea of unable to walk with a good proper walking and with gait alteration for 2 months after the surgery again was very frustrating to her. I explained to this patient that on the left hip, as we see here, it has severe osteoarthritis, severe joint space narrowing, deformation of the femoral head. In the left hip, we will use a different approach, which is the posterior approach. And we will try as much as we can to reduce her struggle that she experienced in the right hip. This is the patient post-operative X-ray. We have performed the left side. The hip is in a very good position. We have done a decent surgery. The inclination and anteversion of the cup is perfect. The patient returned back to her daily activities. And now we can listen to the patient experience after she performed total hip replacement in Emirates Hospital Joint Replacement Center with the posterior approach to the hip.
Hi, my name is Carla Drayson. I've been living in Dubai for 4.5 years now. I work here, have 2 children also here with me. I came to Emirates Hospital for the very first time when I had an ear infection, and I was really impressed by the way I was treated, the kindness, the professionalism of the whole hospital. So I'd been suffering increasing pain in my left hip and an inability to walk and carry out daily duties. However, I was resisting having any kind of operation, and then my daughter insisted on me coming to have a consultation. I looked through the website and found Dr. Ataya in the website, was very impressed with his resume and made an appointment to come and see him. He didn't disappoint at all. When I met him, he was very professional, thorough and considerate, and gave a diagnosis very quickly. He told me that I shouldn't be so old school and put up with the pain. I should get my hip replaced and sorted very quickly. I never dreamt that the result could be as good as it is. I came to the hospital, went for the operation, and within 2 days I was on my feet walking around. Here I am 6 weeks later only, and I have to stop myself from doing too much because I feel so well. I can walk better than I have done for probably the last 7 or 8 years, and it's like a miracle's happened. The staff here are amazing. When I stayed in, I was looked after very, very well. The food was great, everything was good. And afterwards, Dr. Ataya's care for me has been fantastic as well. I've had a few issues with vertigo and he sorted it out for me. I can't speak highly enough about Emirates Hospital and Dr. Ataya.